Thanks, Jenny. We're now joined by the Health Minister, Andy Burnham. Welcome to the Daily Politics.
Hi, Andrew.
BMA says that these deficits are the result of, quote, bad policies and, quote, shocking incompetence. Shocking incompetence. What do you say to that?
Well, I would say that the BMA are entitled to their view, but I would also encourage the people who wrote those comments to sit down today with the annual report of the Chief Executive of the National Health Service. And if they read that report carefully and then reflect on what they've said, they will say that those comments are disproportionate, because what that report shows is the National Health Service across the piece is performing well. Waits are shorter than they've ever been, waiting lists are shorter than they've ever been, and the NHS as a whole is providing very good quality care to patients.
But surely that should follow as night follows day. I mean, you inherited a health service that had an annual budget of 36 billion. With our money, not yours, our money, you've increased that this year to 84 billion. So, of course, waiting lists would have to come down. Of course, people will be getting paid better. More than doubled the amount of money, and yet you still have 1 in 4 trusts in deficit. Now, that must be either bad policies in the government or bad management locally. What is it?
Well, the deficits are concentrated in a small minority of trusts. The vast majority of the National Health Service is both balancing its books, meeting the targets that the government has set, and providing better patient care. And you quote the figures from when the government came into office. I have to say this with Michael here, the percentage deficit was higher when Labour came into office than it is today. I am not. I'm not burying my head in the sand.
But you've raised taxes to put out, and you've increased the tax base enormously, partly to finance this. So we would have a right to expect that you would put it right. Now, why haven't you? It's the second year running.
I would say to anybody, I'm not burying my head in the sand, by the way, and I'm not saying that there are not real pressures in the National Health Service that need to be addressed. That is, of course, the case. But I would also say that the health service in any given year will be under pressure. Like the health service of any major developed country, there will be pressures on that system, and the people working within the system have to manage those pressures. But Andrew, to say, if you're saying to me, where has the money gone? There is no evidence of improvement.
No, excuse me, I didn't say that. So you don't have to go there. I didn't say that. I said that given you had more than doubled the amount of money, you would naturally expect improvements. So that's not my point. Point I would like to make, though, is that you can't wash your hands of these deficits and just blame the trusts. You set targets for these trusts to meet, and some of them you miscalculate. Your contract that you gave to consultants, who now think money grows on trees thanks to your contracts, £90 million more than was planned. The trusts have to pay that. But it's not in their budget.
I actually don't make any apology for targets, because those targets have helped deliver better patient care. They've contributed to the improvements I was talking about. And as I say, the vast majority of trusts are both meeting those if you can let me make this point, Andrew, are both meeting those targets and balancing their books. And so if it were the targets, you would see these problems replicated in all parts of the NHS, across the board, across the country, and that's not the case. And in the report, John Appleby was right to say we're not leaving trusts to fend for themselves.
But who is to blame for these deficits?
There's a combination of factors as to why these deficits arise. It's a complicated set of reasons as to why people in any given locality will face particular pressure on their health service. I'm not washing my hands saying we've no responsibility. Of course we have responsibility. And crucially, we are not leaving hospital trusts, to use the words, to fend for themselves. There is particular support being made available to those trusts in experiencing financial problems.
Yes, of course. But
my local hospitals trust, the East Kent NHS Hospitals Trust, has just had to reduce the number of beds and make staff redundant, not because it's in deficit, but because the government has said that it's going to get millions of pounds fewer next year than it got this year for doing the same amount of work under your new payment system. How can you justify that?
I can completely justify it, because the system, the NHS, has got to move from a system where money at the end of the year just sloshed around. And you, Michael, would have been the first to say this is a completely inefficient system. We need rigour, we need accountability. Well, you're right, we do need rigour and accountability. And we need to have a system where the efficiencies we see in some trusts are replicated in all. And the public, crucially, gets value for money. Now, in putting in place this system, the reforms we've been put in place are actually showing up how finance is moving around the NHS. It is actually turning a light onto the situation.
What's the answer to his particular point about the hospital trust he just talked about?
The answer to the particular point is that there are trusts around the country using the new payments by results system that are actually doing both things. They're improving patient care and they're improving efficiency.
Millions of pounds less than they got this year for the same work. Millions of pounds less next year than they got this year for the same work.
Well, I mean, of course, I would look at the individual circumstances in that particular trust, but I would also say that your constituents, Michael, are receiving extremely
I'm sorry. We hear from the Prime Minister every week and we carry it live. You go from the specific to the general. What we're trying to establish here is a hospital trust is getting its budget cut, even though it's being asked to do the same amount of work.
Well, Andrew, are you saying to me we shouldn't have a system in the National Health Service that hospital trusts are paid accurately and fairly for the work that they do? Moving to that more efficient system, we may see a situation where there is more pressure on trusts as they adjust to that reality. But if you were, between you, both saying to me we shouldn't have that accountability, we shouldn't have that rigor in the system, then I think it's astonishing.
I think, by the way, what you're doing when this happens is something that was called the eternal market, which the Tories introduced and you then abolished, and now you're introducing it again.
Well, no,
it's kind of back to the future on this. But I don't want to dwell on that. I want to ask you this. As a result of these deficits, can you tell us how many jobs will be lost in the NHS now?
Well, the figures that are being quoted of huge, widespread redundancies, compulsory redundancies in all parts of the country are gross exaggerations.
Which is why I'm asking you.
If you're talking about compulsory redundancies, Andrew, the numbers of compulsory redundancies will be far fewer than the headline figures given out.
So fewer than the 12,500?
Yes.
Can you give us a rough idea, though?
No, because trusts are saying that they may have to put a freeze on recruitment, that they may take steps to reduce agency staff. And the figures that the trusts have given out relate to overall the numbers by which they need to reduce staff over the year. That's very different from saying those number of people will be made compulsorily redundant.
Just very briefly, the final point. Would you put down, as one businessman who knows a bit about the health service yesterday did to the Prime Minister, that one of the reasons for these deficits is in certain trusts managerial resistance to your reforms? They don't like them, so they're not implementing them, and that's why you're ending up with deficits. Would you agree with that?
Well, I wouldn't maybe put it as starkly as that, but I would say that the reforms are not in contradiction with getting efficiency in the system and delivering good patient care.
Would you agree with what I mean, it's a simple answer. It's yes and no. Do you agree or don't you?
I did answer. I said maybe I wouldn't put it in exactly those terms. I said that there is no contradiction to my mind between financial efficiency and good patient care. If you can lessen the amount of time people are in hospital, it may be good for the patient and good for the hospital itself.
I don't think I did get an answer to that question, but as usual, I don't decide. The viewers do. Andy Burnham, thank you very much. Now, up and down the country, bosses are PMA says